Hello, Dr. Surenthira. Dr. Surenthira, can you hear us? So you can start sharing your screen. Due to some technical glitches, we are facing certain difficulties. I request the participants to be patient. We'll be starting off in a few minutes.
We all live in we have traveled over the years and many centuries or from mankind through land as well as sea, and in the last 50 years we've been traveling by air for various reasons. Initially trade, for looking for food, but also war also brought a lot of people around the world to a particular place. And these days, it's for trade, education, as well as for holidays. So unfortunately, while we all move around a lot these days, we carry with us infectious diseases along with us. And we have precedents in the past, such as plague pandemic, influenza pandemic, and a cholera pandemic in about 18th century, and most recently we had a flu pandemic, and right now it's a coronavirus pandemic. So essentially, we have to be mindful that every travel there is a risk associated in terms of infectious diseases being spread. I just would like to look at the World Aviation Map, so you can look how much we are traveling and different continents, and the fact that there is every possibility that we might be able to carry an infection from one side of the world to the other in the span of 24-48 hours. And along the way, we have airports, along on the flight, and there is every chance. Thankfully, not all the viruses causes pandemic, and they're all mostly self-contained, and we didn't have to go through this epidemic or pandemic every often, which is good. And in particular, Australia has got important biosecurity measures in terms of they ensure that every person entering into the country is very much screened for a lot of things, and most importantly, they screen for tuberculosis if anyone wants to stay in Australia for more than 6 months. Now, just quickly looking through Australia and its states. Look, Australia is a beautiful country with its landscapes and beautiful beaches, and everyone is welcome to come to visit, actually. But at the same time, we are prone for natural disasters such as we had cyclones, floods, drought in the last many years. But most recently, we had forest fires, which ravaged a lot of forests, but also livelihood of a lot of people. Which means like people are exposed to emergency situations and how they react to it and how they respond in a manner. But also the government are used to emergency situations, and over the years, they've done well, but also not without criticism in terms of how they managed it. Coming to COVID itself, and they've done really well as of now. I would like to just look through the timeline of COVID positive cases in Australia. So the first confirmed case was on 13th January. So this was after the case reports was available in China, and the WHO was warning other countries. So the initial cases were from China. I have to say, Australia has got a strong Chinese population where they have got a strong roots to mainland China as well. So there's been a lot of travel back and forth, and especially around December, January, it's school holidays, and everyone has gone to China, and it's also they have a Chinese New Year falling on January as well. So the moment China had cases, the country itself, such as the political leadership as well as the health, we were all worried that, given that the proximity of the continent as well as increased number of population, we were worried that we'd be the first country to be affected. Secondly, we had a number of cases who are in this diamond princess ship, which was docked in Japan for a long period of time, and I think Australia was one of the countries who sent a repatriation flight to help the citizens to come back to Australia. So unfortunately, this was the cluster of case. It was the first death associated with COVID-19. And we also had a number of cases from Iran, and a lot of people are from Iran, but mostly people come for postgraduate studies. As you know, the earlier cases were from China, Italy, and Iran. And most recently, there was a cruise ship which was docked in Sydney, and wherein there were a number of people who have been sick. And unfortunately, before we got all the results, they were all able to come out of the ship. And later we found out that there was a lot of positive cases. This is being investigated by the government, and we will find out more in the near future. So just to give you a brief look on the health system in Australia. So you could see federal system, and you got a state system. Among them, there is a collaboration between the central and the state on a lot of things, but mainly health-related things. If you look at it, the central government focuses more on the regulatory bodies, primary care, healthcare here. I'm not expecting you to be, wanting to with a structure which clarifies who is controlling what and how much of collaboration or knowledge sharing, especially between different stakeholders, so that any health crisis is especially in this pandemic. So as part of the national response team, so earlier on, the government acknowledged that it's a health crisis, and the health team was formed. Which is the chief medical officer and the health expert group is always there on the sidelines, which on the sidelines, I have to say. whenever there is any health-related issue, so that they get their expert advice, so that they can make a political as well as a social decision on that basis. Pretty much from the positive cases, Prime Minister, Health Minister, and the Chief Medical Officer would be fronting the media in terms of giving them on a day-to-day updates about what's going on, what are the measures from health point of view being taken, which gives us sense of, I guess, for the public, about the transparency about what's going on, and also getting a sense of what it is to be during this crisis, and what are the things we need to be planning ahead. So again, just to briefly mention that about the committee comprising of not only the Chief Medical Officer, but also the state Chief Health Officers, and advising on the measures to be taken during this crisis. So in fact, this working group, they meet every day, or they met every day, because things were changing rapidly on a day-to-day basis. And once the meeting is completed, the Chief Medical Officer would update on an everyday basis. So which was really helpful, I think. So once we found a cluster starting to occur, so there's a lot of measures starting to be put in place. So mainly all the travelers or returning citizens from China, initially from the specific Hubei province, and subsequently to the mainland China. So once it's spread from China to Europe, mainly Italy, Middle East, Iran. So then they just put in a measures stopping all the overseas visitors, apart from the citizens as well as the residents. And within the country, so they started to put in social gatherings being limited, and essentially social isolation as well as lockdown, essentially. So we will look at other slides, how well all these social measures and the lockdown has made an impact. So just looked at, the last one, the facilitated quarantine, which means like we had to find all the hotels near the airports, so that everyone landing in Australia would be quarantined for a period of 14 days, wherein they'll be provided food and information as well. It was a difficult time, of course, and there was a lot of public backlash about how much of facility being offered to them, what is the information being available to them. But overall, I think apart from small minor issues, it's been pretty well managed, I think. So, next, I would like you to look at this slide, which gives us an indication of growth in key countries. So, not wanting you to compare any of those, between countries, but I would want you to look at the exponential growth and the flattening of the curve. So, mainly, what we did prior to the exponential case was putting the social isolation lockdown measures in place, and it only can show us how well we have done, thereby flattening the curve. Mind you, the reason for stopping the exponential curve is to limit the number of patients presenting to hospitals, and essentially the hospitals are not designed to cope with number of presentations to the hospital, and especially admission to intensive care unit. As we know from China as well as Italy, so there's been a huge influx of patients, and the system was really overwhelmed. So Australia, on its part, so ensure that they put in these places, but also they got the personal protective equipment. They had other healthcare essentials to be available to us. So I have to mention about this personal protective equipment. As a doctor, we always used personal protective equipment in Australia for a lot of viral infections, bacterial infections, and the patients are kept in a negative pressure area wherein there is a less risk of viruses or bacteria being transmissible to other people or out of the room. So although we have been prepared with PPE in the past, but there was a huge demand because of the huge number of positive cases. So it was difficult, but eventually the government ensured that we had adequate essential things for the healthcare workers. So just looking at the data from the Australian government. So as of yesterday, so Australia is about 25.7 million people. So out of those, positive cases is 7,000, and unfortunately we had 102 deaths. So if you look at this graph, so you can see there was a small number of cases, and there was an exponential rise. So along this time, the government put in a social distancing as well as lockdown measures, and you could see it has made a big difference. I have to mention as well, I mean, although it was a health exercise, there was a lot of social issues, financial issues. Government has to look after as well. So they put in a lot of measures, and it made a huge difference that we were able to achieve a smaller number now, and the time for us to relax those lockdown laws. But currently, as of now, there are about 31 patients in the hospital throughout Australia, and out of which there are about 5 patients in intensive care unit at the moment. So if you look at the cases by age group, I'm not sure you might be able to see it, but where I'm trained in pediatric population, it's a minimal number compared to it. And if you look at the bottom graph, the number of deaths in younger population, say less than 30 years, is negligible. So in terms of so the information about COVID is out there for anyone within Australia. I'm sure you might be able to access as well. So it gives an daily updates on what measures are being taken, what is the situation, and also it gives the public about where is the geographical location of those clusters, for them to be and also for them to take some ownership for general public, to be mindful where things are, to avoid going to those places, or if they have symptoms, to avoid going to places where there is minimum number of cases. Again, it's just to reiterate how a state department works in terms of response to this crisis. As you can see, the Premier, Chief Health Officer, Health Expert Group, along with the Health Minister, make a local decision about what's going on, considering the socio-economic impact and how well they can provide services to the community. In a sense, having walk-in clinics where if they have any symptoms, rather than going to the hospital and infecting other non-respiratory patients, they can go to their local clinic and get them checked. So there is a lot of measures being taken, and the system has worked really well. So again, just to reiterate about the system in place for us to have not only a top-to-down information thing, but also from bottom to top, so we can raise issues at various levels so that it is being addressed accordingly. So just to go through some of the data in my state. So there are about 400 and among them, 3,000 about 3,100 people have positive for COVID, and out of which 2,600 people have recovered, and unfortunately 50 people have lost their life. So again, for anyone, I think information during this COVID is so crucial. So I think even though it could be a duplication of information, I think it's relevant for the public to access those information so that they stay relevant on a day-to-day basis. So coming to my local hospital, it's important we all work together as a team so that everyone looks after each other, so that all our concerns are addressed to the head of department of different departments, especially the intensive care unit and the emergency department, and it goes to the director of medical services, and this is escalated to the state health department, and trying to achieve in terms of equipment and also resources. During this crisis, we were expecting a large number of people, so there were not enough workforce available. So the government put in a request for a lot of nurses and doctors who have recently been retired to come back to work because physically it would be improbable for us to see a lot of people on the ground, on the hospital to care for them. So in a way, having a loop system, we can identify the shortage in terms of staff, available resources, and this can be fixed. I have to say, it didn't work in one day. Look, initial issues, and then we had to iron out issues over a period of days and weeks, and by the time we had the increased number of cases, we were able to manage it, and the numbers tells us the results. So to going to my personal experience, and so as doctors, this novel coronavirus is new. So case reports from China, this minimal information we are getting, we don't know what's going on. So we are trying to desperately to get information from China, Italy, to understand what this virus does in terms of disease pathology, how does it affect the liver, and on all those things. So not knowing the information has been something odd, I think, for a lot of healthcare professionals, and not knowing the enemy, you feel vulnerable how to tackle it and how we can be prepared. But once we get the information trickling in from China, Italy, we were able to prepare and make sure that we learn the lessons from China. Although unfortunately they had significant mortality, and they were the ones who have helped a lot of health professionals across the world to deal with this crisis. So the main thing was, during this pandemic, so a lot of healthcare workers dealing with essentially a respiratory virus where any droplet is going to be transmitted to the healthcare professionals, mainly when they are trying to put a, you heard about intubation where they put in a tube, and while you're putting in the tube, there is a lot of secretion, and the chances of it going through the face, nasal passage, and mouth is increasing, and it was a huge problem for them, because once healthcare workers were infected, they couldn't come back to work, and there was a real shortage of healthcare professionals looking after all these patients coming with significant respiratory problems. So which was a lesson for us, so that we as health professionals have to look after ourselves, ensuring we wear the PPE correctly, not only wearing it correctly, but taking it off, because the coronavirus, we can talk about, about its, virology, about its DNA structures and all those things. But to be honest, it's about doing the right things every time and making sure that, but also we are not infecting others. And that's the basic principle of approach to COVID. And it had really worked well. So I think the bottom line is we need to be mindful of what has worked for us, and we need to continue to do that and establish that we're doing it properly. In the emergency department, so you've been, we call it casualty in India. So you go there, you see from patients with respiratory problems, chest pain, to appendicitis and on issues. So what we identified is we need to separate respiratory patient and non-respiratory patients, because we don't want a respiratory patient giving the virus to someone with appendicitis, which would be a significant a problem for them, because for them, the appendicitis, you can fix it, but for them, if they catch the coronavirus, which is going to add more health issues for them. So it was very important for us to understand what is and manage the department accordingly. So we talk about team huddle. I mean, it's been in existence for a while, just to ensure that different people within the team are knowing what's going on per shift or for the day, so that we are all ensuring everything going according to the plan. So during this COVID crisis, what we do is that every shift led by a senior medical person would get everyone, essentially the cleaning staff in the emergency department, nurses, doctors, admin staff, everyone come together to find out, okay, are they all happy with their personal protective equipment? Do they know how to use it? And any updated information about COVID, they need to be aware of. Or if we had any positive cases in the department, we will let them know that, okay, who are all been involved in management of those patients, and ensure that everyone is aware each shift. Which means, when I'm talking about each shift, means we have morning, afternoon, and a night shift. So 8 o'clock, 2 p.m., 10 p.m. So we get together and have a plan, and then we go in and continue our work. I have to talk about the support as well as challenges for the community and family. So personally, look, everyone have been really nice. So if you say you're a doctor or a nurse or anyone working in hospital, people ask about how you are, and I think it's really important. Amongst this pandemic, you need to be nice to people, or just be supportive and ask them nice questions. How was the day? I think it makes a huge difference to their so for them to have a good sense of for them to go back to work, I think. And obviously during this COVID crisis, people are worried. If they look at someone with uniforms from the hospital, they tend to avoid them, or some of the times they've been verbally abusive to them, and these are the challenges. We're not new to verbal abuse or even physical abuse in a hospital environment. We know it's a charged environment, and we are used to it. But I mean, you would have to face it, and I think overall it was a positive feedback from the society, and it was good for us to keep ourselves going. And I have to say about family, as you know, amongst the audience, I'm sure one of your brothers, sister, nephew, niece, or your grandparents, someone would be in healthcare professionals, and you'd all felt the difficulty of them going to the hospital, and you're not sure whether they're going to be infected or whether they're going to be alive in the next few weeks or so. And so I think from myself, I can say, although my wife hasn't told me whether she was really worried or not, but you could sense, there is an anxiety. about how they're going to deal with this situation. But at the end of the day, I think you have to be mindful of what you can do, in this health crisis, and ensure that I'm doing the right things at work, and when I come home, I ensure that I am I just ensure that I'm not bringing the virus to my home. So I think that's really important for the healthcare professionals. So I've been training in pediatrics for a while, and I think it's been a contentious topic in the sense, like there's not a lot of information out there about what it is for COVID in children. A lot of data from China, Europe, US, everywhere. It shows that the COVID, for some reason, it's not affecting the children. Well, they might be positive, but only in a few number of cases compared to adult population. Now, we don't know why, and it might be months before we might be able to identify those. But essentially, they might have mild illness, but certainly there is no case reports where they are giving it to other children, but also the adults. It's more adult children, and the children don't have more issues compared to the adult population. So mainly I'm looking at the data from Australia. From age group of 0 to 9, we had about 90 children being positive for it, and there was only minimal admission for fluids or so, but no intensive care admissions. And from 10 to 19 years of age, there were about 220 cases. So they have done well, and current evidence suggests that there is no child-to-child transmission, and they should be able to go to school. And that's the advice from the health expert group in Australia, and the school has opened for them, and they're all going back to school now. Now, we don't know whether this evidence will change. Unfortunately, COVID, we don't know anything. We know some of them, but a lot of it we don't know, and this might change. I think for a general public, we need to be aware that we need to look for if there's going to be any health advice. I think WHO put out statements on a daily basis, and I think if you wanted information, you rely on well, I don't have to say you don't have to rely on it, but these days anything happen across the world, media brings it to all the public. Even before the health professionals knows about some of the treatments, such as plasma therapy or hydroxychloroquine, the public knows about it. So the information is out there, but essentially I would be very cautious in terms of what is available in the media, because it is easy for the media to give some information, but I would rely on health services to understand, okay, is there going to be any effects of COVID in children, and ensure that we follow the guidelines accordingly as per the local guidelines. I mean, from Australia point of view, we are happy for them to go back to school. And there's been some case reports about an inflammatory condition. I don't want you to Google this. To be honest, there's only case reports mainly in Europe. But we're not sure whether it's an incidental finding, because the inflammatory condition do occur on a regular basis. So we do see cases. So it's just that COVID has occurred, and we are seeing some of the children presenting with this inflammatory condition. So it's not a lot of report, but it's just to be mindful and aware that this can occur. But once again, once we see a lot of case reports, then we would ensure that the public are aware. I want to let you know about these chronic health issues. I think the COVID itself is not a problem for them, but if they have other chronic, say, respiratory problems, so if they were born premature and if their lungs are not well developed, or if they have chronic asthma which is not well treated, if they had some immunocompromised state, say if they had a liver transplant, if they had cancer, where the immune system is really, it's not fighting well. So those children, I think we need to be careful about sending them to school or public places, and ensure that if they have any mild symptoms, we need to seek medical. So again, so the local health district put up information for people within the catchment areas about these walk-in clinics and getting information on a day-to-day basis. So just getting towards the end now. So what is the immediate future? So we talk about the new normal to be adopted for the services. I think for the health care workers, as I mentioned earlier, we need to continue educating them on the use of PPE and ongoing current evidence in the management of COVID-19. Look, this talk is not about what we do in ICU, what are the medications we do. I'm sure you would have heard about it in a lot of discussions, but I can only say that leave it to the doctors, and I mean you can always ask, question the doctors. Okay, what is we are getting this media report about these anti-malarials, antivirals. So what do you think? So and they would be able to give you more information and specifically for presentations, and I think that would be really useful for them to decide on a case-to-case basis, and I think that's the general advice I would give it to you all. And also, there's always going to be any surgeries. So for healthcare workers, we need to minimize the exposure to the virus. So we need to screen all the people who need to go for surgeries. And I think, it's a continuous work on, what is relevant to a particular area, I think. So for the government, look, I think government plays a vital role in the management of COVID. Without the government resources or government machinery, it's going to be really hard, getting this COVID under control, because you need health, social, economic, all these things to contain this virus. I mean, without government taking the ownership, and it's going to be really hard for any small organization or any goodwill people to make a difference. So I think for them, they need to continue to educate the public. They need to look for possible pressures and control them effectively, but also mainly supporting the healthcare workers, providing protective equipment, and also managing their workload, because we don't want any tired eyes or legs in nursing or doctors to be looking after people. So we need to make sure that there is a roster in place and everyone given enough rest before we go back to work. I think public, it's really important that we drum into their mind about hand hygiene. It's really important. I mean, we say it a lot, but as I mentioned earlier, that is the only a good way where we have prevented this coronavirus spreading to others. So it's really important that we continue to educate them. And I think public has got a big role to play in terms of understanding the efforts taken by the government, healthcare workers, and the lot. And it's time they need to take some responsibility about what they can do to make a difference to the outcome of the fight against the virus. So we just quickly touch upon existing challenges within the sectors in effectively managing the current and future situation. I think I can say for Australia, preparedness is the key because we're seeing a smaller number, but we need to ensure that we are prepared for the second wave of infection. We got the personal, the hospital readiness. And I think the collaborative approach by local hospitals, state and national leadership is really important to ensure there is a closed loop and we're all in this. And sharing of health information within the health expert groups nationally as well as internationally as well, so that there is a consistent approach. But having said that, we need that it would be really difficult to apply the same principles in different healthcare and socio-political system. Just to touch upon it, Australian healthcare is essentially a public healthcare system where the government manages a lot of things. There's only minimal private hospitals where they manage elective surgeries and so on. But if you look at India or US, for example, there is like private hospitals. So you need to work out which works for the particular healthcare system, so that you deal with it accordingly, rather than one size fits all for all the countries. And again, the important thing is we need to introspect our own healthcare system and make necessary changes. I mean, we're always worried about weaknesses being known to people, and we try to avoid showing our weaknesses. But I think for both public as well as for government or anyone in this instance, so we need to be readily accepting the fact that we don't know. I mean, COVID-19, all the health professionals put up their hands and say we don't know. Sorry. And I think there should be the attitude for everyone. So if there is a weakness, we accept that. And the public has to say, okay, look, we don't have the system in place. So we need to ensure that we can plug all those weaknesses and also working on our strengths. I was just going to touch upon people with other health issues. Look, as you know that COVID, people are worried to going to the hospitals. And I think I mentioned in children with chronic illnesses, I think it's the similar for people, adult population, where they have increased morbidity in the sense, they have a lot of health issues such as hypertension, diabetes, and other respiratory problems. They have to make sure that they should find a way where they can speak to their doctor either through phone and ensure that their condition is being monitored, or at least stable, because we don't want people being at home afraid of going to the hospital, and then after a week, because they were neglecting their own health, and then end up being in intensive care or and other issues. So I think we need to encourage people on other health issues to seek medical attention appropriately or as soon as possible. So the various opportunities are thought about forming a health experts group if we don't already have one, because that's really important for any country which can advise the government in taking the initiatives to tackle not only COVID but also other health issues which is across the society. So I think it's really important. But also it is a time for collaboration with health experts nationally, but more emphasis on local research and support system to be put in place. We know that there was no lot of virology lab in India, so there's been a lot of regional laboratories being put in place recently. I think that's really encouraging, and it continued to occur for health professionals to have a local expert, I should say, rather than relying on someone away who might be busy with their own work. So we should develop a health expert group regionally, so that they would be able to guide the government. And I think there should be ongoing education for the public, so that they are not only fighting this pandemic or the epidemic, but there's a lot of endemic health issues. So I think it's a good opportunity for everyone to come together. So just to quickly, I was really happy that the shop has put in these webinars, inviting the media, health, and entertainment industry as well as education. I think not only for COVID, for a lot of things, it's a team approach. I mean, as you can see, the social workers play a huge role in the community. Because you see a doctor, we give them advice, and then you go home. I mean, until you come back to review us, but I mean the social workers in the community can go back and essentially, I mean, there's a lot of work has been done by the social workers, but I think it's really important that you all doing a great job, and you should continue to do that and ensure that you're giving the advice relevant to the time and also relevant to the specific community. And media, I have to say, I have to thank for yesterday's talk. I mean, he did a fabulous talk about media's role. I think media has questioned the government, and having questioning someone there to question them on behalf of the common people. It's really important that the government makes changes, and which helps the rest of the group, such as the health and the social workers, are able to deliver those information to the public. So lastly, sorry, I know we are running out of time, but so from this presentation, I would want you to take home the important things. So while it's really nice for everyone to compare the stances across the country, I think we need to understand our own strengths, and we should continue to work on our weakness. And I think it's good to gather information from others, but I think we need to have our own organizational structure which is ready and running, not only for health emergencies, for as I mentioned earlier, floods or any unnatural events, say we had tsunamis. So I think we should be prepared and up and running, and we need to continue to study. And I would like to add, in fact, there should be a lot of people going out of the country, going to all these places where they can share learning. Say they can come to Australia to learn how they deal with forest fires, or how they deal with cyclones, and vice versa. I mean, for Australia, they have learned a lot from rest of the country. As I mentioned, China and Italy has been a great resource during this crisis. So look, there's always going to be, definitely we never have, the better, I guess, way of countering any problems. But I think any crisis, there's a silver lining, and we should be thankful. I have to say that we learned ourselves as a health professional and the weaknesses within the system, which we may not have been aware of otherwise. So I think it's really important to understand those and work on those. And it's really important. Look, the pandemic has been there for many centuries, and I think we need to continue passing on this information to subsequent generations. And as a society, we should be able to do better next time, and every experience counts. Thank you so much. I'm really sorry I've taken a bit long time.
Thank you so much, sir. So we have a few questions from people. Mr. Andrew Benjamin, he asks, how is the Department of Health in Australia is going to address the post-traumatic stress that the healthcare workers like nurses, doctors, and other specialists working in hospital who have worked in COVID care are going to face after this pandemic?
That's an excellent question. I think it's. I think we are not thinking about it. I think for now, I mean, essentially, once the pandemic comes out, we'll be able to find out, how much it has impacted, healthcare professionals. But as I mentioned, having the information earlier on, preparation and ensuring that the information is shared amongst the healthcare workers on a day-to-day basis has made a big difference. I think the counseling has already commenced, I think, for me. Which would be a really, which is a good start. And again, we always have a session where we say, if it was an adverse outcome, what we do is that as a team, if not on the shift, we come back the following day, and then all the nurses, doctors, and everyone involved in the care of those, we sit together and we talk about what had occurred. So we tend to do it on a day-to-day basis on different scenarios. Say any adverse outcome. So we have done it earlier on, and we are continuing to do it. And I think so. There's been mental health resources available to a lot of healthcare professionals, which is up and running already. So I think it will be a significant impact. Having said that, we have been lucky so far that incidents have been low. So there will be an ongoing thing, and people will have an opportunity to talk about it. And I think we are doing well already.
Sir, the next question is from Jim Reeves. He's asking, what is the suggestion you have for the children in rural and slum areas? How can they be informed about the handling of this scenario? And what is the best time period for children to be at home? And how can we handle the children on the move with their migrant parents?
Well, it's really important. It's a good question. I think so. I'll give the experience from Australia. So, what Australian pediatrician or some of the people who deal with, people who work with children in primary school and childcare, what they have put together is a nice information for the kids to understand in their own language what is COVID and things like that. So although it's English, I might be able to send it across to you, reproduce it. But I think someone has to take that ownership of preparing a kind of a comic book or something which there is like a visual medium of communication, explain to them what is coronavirus and such. So that's one about educating the children. Secondly, look, most of the children, you want to be happy, not caring about anything in the world, and that's the important thing. So you can't really tie them to a room. I know I have got 2 kids, and it's really difficult to put them in a room or put them at home. But I think so you have to let them be on their own, but ensuring that so they are well looked after. Kids in slum areas, we need to understand whether they have adequate nutrition on a day-to-day basis. What is available? Is the government providing any resources to them? Is any NGOs can offer healthy food for them to ensure that they are well nourished food. I think we know that if you are healthy, you can fight this virus. There's a lot of unknowns about what is the healthy thing which can protect people from COVID. There's a lot of things on WhatsApp or social media. People talk about it. I think eating a normal, healthy diet, and apart from if you're not having any chronic medical problems, I think you should be able to deal with it. Whether you are in a slum area or whether you're in a middle class settlement. I think. The question was, because the vulnerability of those children in slum areas, and it's really important. There should be a lot of resources put in place for these children, so that they are ensuring that they get adequate education, adequate healthy diet, but also I mean, about migrant workers, I'm not sure about whether the children are with their parents or whether they are being cared by their relatives or someone else. But I think in a time of crisis, the kids, would need to be with their parents. I mean, because parents are a source of comfort, and so you need to ensure that so they are with their parents, if not a close family, and make sure that any questions they are answered, or that they need to be in a felt in a secure position, I think, or securely.
So the next question is from Ms. Chanti Hopper. She's with the organizing team. So her question is, what is the learning India need to adapt from Australia looking at the flatten curve? What is your advice?
Thanks, Dr. Charlie Harper, for organizing this. It's been an invaluable information for a lot of people, I'm sure. Look, again, so the adaptability to our Indian healthcare is again, I think people have to be open about learning from others. I think that's a sensible thing to do, and I think Australia has done that, learning from China and Italy. So I don't think I don't think why not Indian healthcare professionals, or they can speak to their counterparts. I'm sure they are doing it. I mean, because I don't know what the circumstances at the moment, but they are doing it. It may not be obvious in terms of the results, but I'm sure they are doing it. I think they need to talk to their counterparts and learn from it. Again, the Australian the societal setup, or the population spread is entirely different to India. As I mentioned, it might be difficult, but I think one of the things they can learn is upfront with the public. So tell them that we don't know the results, but we need to talk to their counterparts, and the Australian societal setup is entirely, as I mentioned, it might be difficult, but is upfront we don't know, and give and it's not only health socioeconomic impact. So we welfare and looked after, giving the messages, because people panic. I have to say, I mean, panic is good, because unless you give the information.
So, so Sir?
Hello?
Hello, sir.
Kindly, I request the participants to kindly bear with us. We'll get back to you as soon as possible. Hello, ma'am. Sir, could phone button? Okay, okay. கொஞ்சம் login பண்ண சொல்லுங்க.
Should be some connectivity problem at this end.
Sir is trying to reconnect again. I request everyone to be patient. Thank you.
Diseases. So, in fact, as part of the lockdown measures, they have ensured that there's no people traveling to those remote communities. So far, we haven't heard any positive cases in Aboriginal population, and again, pretty much for a lot of children within Australia, so the cases have been low, and the government has made a special effort making sure that it doesn't reach those remote and vulnerable communities.
Thank you, sir. The next question is from Mr. Gracelyn Pavitra. Her question is, India has also been locked down for a long time. What else has to be done in terms of reducing the number of cases in India? And what restrictions in India would help them in terms of flattening the curve?
It's a bit of a difficult question to answer in the sense because we are in the middle of pandemic already. So I think the key thing which we learned from all the other countries is to put in place preventions even before the virus hits our home. I think that's pretty much it. So because once the WHO put in an information about the pandemic, the rest of the world caught napping, unfortunately. So, which made it very difficult because the spread has already occurred. And, in fact, we are chasing the tail. And what we can achieve from here on is to ensure that all the clusters of cases have to be contained and ensure that there's no further cases. And I think it's a difficult landscape wherein you have a huge socio-economic impact secondary to coronavirus. So for people to not go to work for like a couple of months, it makes a big difference to their livelihood. So it's been a delicate balance between containing the COVID, but also getting people away from public places. I think it is going to be a combined I think effort from the government as well as the social I think social responsibility of the society on the whole to ensure that we are providing adequate coverage economically for those vulnerable people or people, so that people don't have to go out mass, and that would reduce the chances of spread.
Okay. Thank you, sir. The next question is from Dr. Francis. This question is there any specific reason for COVID-19 infected cases being on a high rise, especially in terms of elderly population? And what steps could be taken to prevent this?
It's an excellent question. Look, what we know is elderly population as such, they are vulnerable to a lot of diseases where their immune system, because of age, they are low. I mean, for them to fight the infection, and the fact that a lot of elderly population, they've got chronic medical issues such as they have hypertension, or they would have had cardiac surgery for say cardiac arrest and other things, and also there's a chance that they have a chronic respiratory problems. So we call it chronic obstructive pulmonary disease, which is a chronic respiratory problems where the lungs are not working fine. As you know, for any virus fight or any bacterial illness, you need to have a good immunity to ward off the viruses immediately, when they get into the system. But unfortunately, the aged care population, along with their other health issues, it's very difficult for them to, fight against. And the issues, especially Europe and other countries where there was a huge mortality in aged care, because a lot of people live in aged care facility, which, I mean, in Indian society, it's not very much prevalent. We still have only pockets of aged care facility across Tamil Nadu, for example. But in other European countries, even Australia, there's a lot of aged care facilities where they live there because the family can't look after them, so they go to their facility where they have a nursing care. So one person, getting caught the virus, there's every potential possibility that we can spread to other people, and that's how we have seen a lot of aged care fatalities in a lot of countries. But I think, given that India, we don't have a lot of it, perhaps that might be the reason why the aged care population is not being affected a lot. I think that is an interesting study, which is an important from healthcare point of view for research, as well as for social workers. They can take up a study and understand where are the positive cases and how many of people are there in terms of age group more than 65. Understand how much people are affected. So it's a good research project, and then explain why we have less increased mortality in the age group.
Okay, thank you, sir. The next question is from Ms. Renuka Vijayan. She's asking, with the increased risk to healthcare workers in terms of addressing the pandemic, will the present students or the generation show interest in terms of joining as healthcare workers or pursue relevant healthcare courses for becoming healthcare workers?
Look, I can understand the reason why you're asking the question, but I have to say, look, we all are vulnerable. Any profession we take, or it's you encounter a lot of difficulties, and but health professionals, as said, they want to do the job because they were very keen to do this, and they looked up to their friends or fathers or health professionals, and they want to be part of it. I think for the health professionals, I think they are keen, or the current students, I would encourage them to take up health if that's what they want to do, but not fearful of what they're going to encounter. I think for them, as a society, which includes the public, government, is to ensure that the students who are keen, we need to support them. We need to tell them, look, you take up if that is your passion, and we would support you all the way through. If you need education, if you need the equipment, I think that's important. So you need to put in a lot of resources for the young buddies to become doctors, nurses, or any other healthcare specialty, and that's how we need to look at it, rather than turning them away because of one pandemic.
Due to lack of time, we'll just stop with another last two questions, sir. This question is from Mr. Arul Kumar. He says that people are abiding by the government instructions in terms of social distancing, washing hands, and things like that. But do you think that this has been the main reason for Australia to stabilize the situation?
Well, all we can see is it had shown the numbers. So we know prior to social distancing or limiting the number of people, there were exponential cases. And after we have done that, the numbers have decreased. So I think there is definitely direct correlation of what we have done and what the data shows. But I have to mention how effective we put these things in place. I mean, if you say social distancing, it has got to be social distancing. You can't have either way. We can't really say, okay, social distancing, but and you can go out for a few hours and come. No, there's got to be followed up really religiously and ensure that this occurs. And I can say that whatever plan in place we put in, we have to ensure that there is 100% people abiding by it, and that's how we can predict what the outcome is.
The last question, sir. This question is from Ms. Shanti Hopper. She says, while World Vision India works in communities and with children, what would be the message for healthcare systems that need to be strengthened, especially focusing on children?
Well, I think children are very, very important for the future of this country, and I think it's better to say that we put in all our efforts and time and resources to ensure that the children are taken care of. Well, to start with, I know World Vision is doing a lot of work with children in remote population and also vulnerable society, and ensure that we make sure that they come out of their wherever, even if they are vulnerable population, so that they can be a positive to the societies, and they are the building blocks of the society. And we have to address their needs, especially as I mentioned, education is really important for them to understand between what is news and what it's not the news, but also they have the ability to look after others as well. So I think it's really important, so all the NGOs, or including the World Vision, to continue your work, but also put forward your themes to the government, telling them what's required. And I think it's an ongoing dialogue between different stakeholders, and ensure that we can only strive better as a nation and look after kids as a whole. And I think and having a healthy, aware, educated children are the goal of the nation.
Thank you, sir. Finally, what would be your concluding remarks for the new normal for the healthcare sector?
Well, it's been a huge learning curve for all of us, and it just give us a perspective that we don't know a lot, and it's also given us an opportunity to learn from others, talk to others, understand their experiences, and try to put together a plan so that we can work as a team and ensure that the pandemic is under control. Well, it was an opportunity, to talk to a lot of my family and friends about this. So I think we should continue to work, and we can fight this, and we can come out more stronger, more wiser. And I think we should look at positively and keep fighting. And thanks for the opportunity.
Thank you, sir. Thank you for the wonderful session and for your patience in terms of answering the questions. And now I request Ms.